Welcome to this explainer. Today we are diving into a really groundbreaking 2025 study from the Journal of Periodontology. It's titled Pulsed Electromagnetic Field Therapy on Non-Surgical Treatment of Peri-implantitis. Now, why should you care? Because finding a non-invasive way to just stop bone loss and kill inflammation around failing implants is literally one of the biggest hurdles in modern dentistry. So let's get right into it. Which brings us to the million-dollar question. Can we actually predictably treat peri-implantitis without going in for surgery? If you're a dental professional, you already know the stakes here. Peri-implantitis is the #1 cause of late implant loss. And look, we all know the limitations of the tools we're currently using. Traditional, non-surgical mechanical debridement, it often falls short when things get severe. I mean, sure, it might reduce some superficial bleeding, but it really struggles to resolve those deep pockets or halt that progressive crestal bone loss. And that is exactly why this specific multi-center randomized control trial is such a big deal. The researchers didn't just look for a quick fix or immediate short-term healing. No, they evaluated the clinical and radiographic outcomes over a 12 to 26-month follow-up period, with the average being 20 months. So we are talking about sustained long-term stability here. They wanted to know if this new tech could truly reset the biological environment around a diseased implant. To understand the how, we need to break down two key acronyms. First up is PEMF. That stands for Pulsed Electromagnetic Field. This isn't new science. It's actually a widely established technology used in orthopedics because it has these incredible immunomodulatory and bone healing properties. The second term is MED. That stands for Miniaturized Electromagnetic Device. And here is where the engineering gets super cool. They took this proven, historically bulky orthopedic PEMF technology and literally shrank it down, integrating it directly into a standard dental healing abutment. Okay, so what did this look like in actual practice? The study tracked 47 implants that were showing clear, undeniable signs of peri-implantitis. We're talking 6 to 8 millimeter pockets and visible crestal bone loss. The methodology was beautifully simple. Step 1, do your standard mechanical debridement with Teflon-coated curettes and rotary brushes. Step 2, install the MED healing abutment. And Step 3, well, just let it work. The device delivers active PEMF exposure within a 2 millimeter radius for exactly 30 days. And get this, they used 0 supplemental antibiotics. Not at all.
The results? Honestly, they're striking. Take a look at the data in this table straight from the study. If we look at the deepest probing depth, the test group, the ones receiving the active PEMF therapy, dropped from a baseline of 7.1 millimeters all the way down to a super healthy 4.6 millimeters at the long-term follow-up. The control group, which just got a sham device, only managed to drop to 5.4. But the absolute wildest shift is the bleeding on probing. Both groups started maxed out at 100% bleeding. At follow-up, the control group was still struggling at 80%. But the active PEMF group, that number plummeted down to just 17.1%. That is an incredible reduction in active inflammation.
So, how did these numbers actually translate to definitive clinical success endpoints? Well, the study defined success using very strict criteria. Pocket depth had to be under 5 millimeters, absolutely 0 bleeding or suppuration, and absolutely no further bone loss. Based on that rigorous standard, the control group hit a 54.54% success rate. But the active PEMF test group, they achieved a massive 68% treatment success rate. Plus, the active group even showed a slight trend toward actual vertical bone gain over those 20 months, while the control group just continued showing slight bone loss. So what does this mean for you when you're standing chairside? First off, it massively enhances treatment predictability. By using that MED to modulate the microbial environment and stimulate the tissue during that critical 30-day window, you are getting much more reliable healing. Second, this is a prime, textbook example of effective tertiary preventive dental care. You're halting disease progression and restoring function without instantly reaching for the scalpel. It really proves that PEMF is a highly viable, non-surgical adjunct therapy that can keep your patients out of the surgical chair. Ultimately, this explainer highlights that we are standing right on the edge of a totally new frontier in implant dentistry. We're talking biophysics meeting periodontology, right at the cellular level. Are we approaching a future where reversing peri-implantitis is as predictable as placing the implant in the first place? It certainly looks that way. Follow Magdent on Instagram and LinkedIn @Magdent MED and visit magdentmed.com to book a demo.